Hello everyone. We just had a wonderful workshop with Christine, and she's been presenting on sexual function, and we had a discussion, and I was presenting in the other session, and our talk quite overlap a little bit, and we want to discuss this further with you. So Christine, I would start by asking you, can you just explain what was the topic of your presentation?
Well, I presented a very challenging topic.
Oh, I'm sorry.
But it was fantastic because I've learned a lot, and I brought the perspective of physiotherapists contributing for treating, improving pelvic floor dysfunction and sexual function. Mm-hmm. So I addressed first what is the role of the physiotherapist, mm-hmm. and we should have, when dealing with women with sexual dysfunction and also with pelvic floor dysfunction, it's really important to have this broad view of women's health issues, so we can advise, instruct, and help women to have a better quality of life that really impacts in sexual function, mm-hmm. and also in pelvic floor dysfunction. Mm-hmm. So I addressed first this issue, and we have, as physiotherapists, this global role in related to functioning. Mm-hmm. So it's really important to assess movement, impairments, and the impact on activity and participation. And also we have this specific role related to pelvic health, that we should always access pelvic floor muscle function using in clinical practice. Sometimes we don't have access to tools like dynamometer, but mm-hmm. we still have to access using vaginal palpation and what we have, inspection in clinical practice. But it is really important to address women's report, use outcome measures that can be valid and reliable to access pelvic floor symptoms.
In your presentation, you mentioned something that really resonates for me, is that you're saying not all women, you have to ask them what they want, because not all women want to have the same level, and this is part of the questioning that we should ask to women. Is it typical in Brazil that physio engage in the sexual function aspect and go in that direction, or is this something that is quite new and that you are teaching to promote this?
Well, I think if we work frequently with pelvic floor dysfunction, there's really an interaction between the problems of pelvic floor dysfunction, because we know that women with pelvic floor dysfunction, they have so many complaints related to sexual function, mm-hmm. Because they have their sexual life impacted by urinary incontinence, anal incontinence, pelvic organ prolapse, and pain. Mm-hmm. So it's really common that we, when we take their history, when we investigate what is happening, we have to ask them about their sexual life. And I think that in Brazil, as in most part of the world, I think we need to have a better preparation for this, mm-hmm. for this interviewing and for the communication. It's something that I think we still need more preparation, don't give enough value for this, the importance of this. Sometimes we are very concerned about the techniques, applying the techniques, and we are not enough concerned about communication and our abilities to communicate and to ask for permission and to know how we are going to address sexual problems. Mm-hmm. So I think it's Sexuality is a field that has appeal. And many physiotherapists, as other health professionals, are entering in this field.
Yeah.
So we really need to be evidence-based,
Yes.
to offer things that really can make a difference in women's lives.
Yeah.
And also to have this ethical concern about how we address this.
And in your presentation, you presented the data of a meta-analysis, and it was interesting because it was going in the direction that pelvic floor muscle exercises could have a role in sexual function. So can you tell us about, a little bit about this?
Yes. From the clinical practice,
We saw that already. Yeah.
With patients, they tell us that when they do pelvic floor muscle training, they improve their sexual lives.
Yeah.
Or some aspects of their sexual lives.
Yeah.
Because we need to really have this clear in our minds. Sexuality and sexual function involves so many variables.
Yes,
so
of
it's
course.
so difficult to say that you're going to offer pelvic floor muscle training and this can resolve, this can really
Of course not.
help treat all kind of problems.
Yeah.
Because we know about the complexity of sexual function and sexuality. But this is something that we can, working with women with pelvic floor dysfunction, it becomes clear that they start to refer an improvement in their sexual lives. But we didn't have studies that were specifically aimed to investigate sexual function.
Yeah. It's all secondary outcome. It's not, they were not designed for that, but it was one of the outcome that were added, right?
Right, exactly. And so there are many limitations in the RCTs we have available. Now we have more studies that are specifically designed to investigate sexual function, and this is good. But we could pull data from 4 studies using FSFI.
Okay.
And which is a tool that is validated and it is reliable. It is responsive, but there are limitations too.
Yeah, it's not perfect.
No, it's not perfect. There are limitations, and frequently this stress is not accessed, and it's important to access this stress border that women refer. So the studies, they have limitations. We access it using Pedro scale, and we accessed to we had 2 assessors, and the quality of the studies were more than 50% were moderate, but we had limitations. Especially the heterogeneity, the statistical heterogeneity that was really high, and we had the risk of bias in many studies that really lower. We downgraded the evidence.
And I recall also that you mentioned that if you assess their pelvic floor muscle training protocol, they were kind of missing a lot of information to be able, so that we can replicate this study or replicate this into clinical practice. So the dosage and information about the training was kind of limited. So that could be a room for improvement for the future studies.
For sure. This was one great problem that we found when trying to collect data. That data we needed was not there. When we're trying to find informations that are really important to know, like the dose response and the type of protocol. But as even not having all this data we needed, we noticed that the studies reporting data properly,
Yeah.
they usually direct the protocol. The protocol was, most of the protocols were using the rationale to treat pelvic floor dysfunction. So it's something that we should think about it in why a protocol for women without pelvic floor dysfunction have to be exactly like a protocol
For
directly
incontinence.
for pelvic floor dysfunction. So these are things that we should think about it, and also that we had mixed population
Yeah.
in relation to pelvic floor dysfunction, sexual dysfunction, and maybe we could have a larger effect if we have studies including specific population of women with
Less heterogeneity than in. Where my work complement yours is that when I was listening to your presentation and I was thinking about the role of the pelvic floor muscle exercises in this field, I was wondering, is it possible that the improvement that we are seeing in sexual function is more related to the reduction of their pelvic organ prolapse symptoms? So they have less incontinence, less prolapse, and this is why their sexual function improve? Or is it like a true improvement of their sexual function because they have stronger muscle, it pushes the blood in the clitoris, they have higher tonicity of the vagina, so it's not related to their dysfunction, it's more like a real effect on sexual function. So what we have done is that we have conducted a similar review than you did, but in women with no symptoms. So to see, but again, the numbers were limited. And the limitation that you mentioned, we encountered the same because the outcome, the lack of information on the training protocol, that the outcome were not designed to assess sexual function. It is like a secondary outcome, so it's not powered to detect difference. But still, we can see some promising information about this, and I think that the future should look into the involvement of physiotherapists in sexual dysfunction. So that could be a way that we can improve and help women. For you, with all your work, what would you say that we can do in future in research to progress this field?
Well, I think we should have RCTs of good quality.
Yes.
And protocols that that have rationale to work. So what would be a good quality intervention in this field?
Sufficient dosage, sufficient supervision,
and what we want to measure, what we need to measure. Do we have the outcome measures we need to answer to these questions?
Yes.
This is something really important because when we talk about improving sexual function, and when we are offering an intervention like pelvic floor muscle training, what could we really improve? I think there are things that we're not measuring. Use these questionnaires we have available. Like, are we really measuring the perception? Is the perception of women about her vagina, about the penis in the vagina, and the pleasure is being properly measured in relation to the exercise, in relation to pelvic floor muscle contraction? Does the pelvic floor muscle contraction can really increase women's perception of their pelvic floor, or things that we cannot measure today properly? Are they able to relax their pelvic floor muscle after they contract why they are contracting their pelvic floor muscle. This is something that is really important to investigate, because we know from the clinical practice that women sometimes they say that they contract their pelvic floor muscle because they feel the vagina, their vagina loose, so they contract to provide more pleasure to the partner, which is okay, but we don't access these categories, these domains that could be investigated, and we don't investigate intensity of orgasm, for example.
Yeah. And the way they are reaching orgasm, is it through penile penetration, or is it clitoral stimulation, or this aspect is not covered to my knowledge in any of the available questionnaire, right? So that could, physio maybe, or pelvic floor training could have a different effect on one or the other, depending, but we are not currently measuring that.
Yeah, I think tone is also a challenge, because we don't have
tools, or there's no perfect tool,
standard to access. But I think that one promising field that we should invest and really try to conduct research related to it is the whole body influence, the movement of other parts of the body.
On the pelvic floor, or?
Yes,
okay.
On the pelvic floor.
Okay.
And also how much the stress of daily life can influence our muscle contraction patterns, not only in the pelvic floor.
Yeah.
And because we have a great potential to offer interventions and to diagnose these patterns, the central patterns, and also I've learned a lot about it at the Linda's McLean lab in relation to the research they've been conducting, and I think it's one promising field for investigation and for new interventions focusing on movements, stress, to break the cycle of stress, and how this would impact the pelvic floor.
So I think you just describe like a full research program that we will need help to do, because we cannot do that on the rest of our career. We would need more therapists to engage in research and contribute. I would just want to wonder, is there any final message that you would like to tell to the audience to promote the talk so that they are encouraged to look at our video?
Well, I think we have so much potential to help women to improve their quality of life, and to improve their quality of life means that we can also help them to improve their sexual lives. And so I invite everybody to join us in this challenge to offer women a better quality of life and to conduct high quality research to help women in this field.
So thank you very much for your attention, and I hope that you will enjoy our video.
Thank you.
Oh, thank you so much. You were good. So that's another career. I'm an interviewer now.
Yes, that's it. Yeah.
With no preparation.
Oh, fantastic. Well, it's lovely to listen to you both talk.
Thank you very much. And we were hearing the music start.
Oh, yes.
So it's good.
Yes. Where are we now? So,
What time is it?
it's about 7:15.
Oh, okay.
Yes. The time has flown today, hasn't it?
Yeah. Thank you so much.
Oh, thank you. It's great to work with you both.
You are amazing as usual, and then we will do all the. I think I heard of your glasses, Christine. So see you around. Are you going to the gala?
Oh yes.
Okay.
Yeah, we'll be there.
See you on the dance.
Yeah, great. See you there. Thank you, Christine. Lovely to meet you. Enjoy the rest of your conference.
Yeah.